Hello, I'm Dr. Sri Lakshmi, consultant WM in Healthcare Services, working in Rashtrotana Hospital in the Department of OBG. Today we'll talk about PCOS facts. Okay. So PCOS is a big terminology called as Polycystic Ovarian Syndrome, but nothing to worry with that. We all know that around 8 to 20% of the people, of the women who are in the reproductive age can have PCOS. What are we worried about PCOS? PCOS can have a short-term implication and a long-term implication on the health of the woman. Okay, what are the symptoms? So it's a group of symptoms which is called as a syndrome. The symptoms are woman or an young girl can have an irregular periods. The bleeding can be heavy, less, or it comes regularly or irregularly. And there can be chances of putting on weight, excessive hair growth where we don't need, and hair loss where we need to have the hair, and sometimes excessive of darkening of the skin, especially in the nape of the neck and in the axilla. So these are some of the concerns of PCOS. Now, what are the implications of the PCOS for an young adult, for an young woman? Okay. So usually the college going girls can have symptoms like irregular periods, or more concerned about excessive hair growth on the face, or also they are concerned with pimples or acne. So in that way we have to manage them, managing their reducing the hair growth and treating their acne, all those symptoms. But irregular periods is not a big concern in an young age. If a woman or a child can have at least 4 periods in a year, that's more than enough. So we're not much worried about it. Later on, once they get married, there can be difficulty in conceiving. They can have a problem in having a baby because the cycles are irregular. Cycle should be regular, the egg has to be released regularly to have the baby. So we have to correct that symptom. Now after the delivery, during the pregnancy, what happens, sometimes they can develop sugar also, because the changes in the body, what will happen for people who have sugars, the same changes can be seen even in the girls or women with the PCOS. So we have to manage the sugars also. Later on, after they have completed the family, again may women come with the irregular periods also. Then we have to manage their cycles. We have to give medications to regularize the periods. Now the question is, does PCOS doesn't have a permanent solution? The same question will be asked by the young woman, old lady. Everybody will ask, why don't you completely cure my PCOS? So PCOS cannot be cured. For example, if somebody had dengue, I know it is caused by some virus, we have to treat them symptomatically. If somebody had malaria, I know it is because of a parasite, we can give her medications. But here we don't know the exact reason why a woman or an young girl will have a PCOS. It is a modification of expression of their genes which are susceptible for this disorder with the lifestyle changes. So the treatment for this is not definite treatment. It has to be based on their symptoms. As I told you, in a young child we have to manage her excessive hair growth and acne. In the women in the reproductive age, we should help them for conception. In the old age women, we should help them to have their cycles regularly. So what is the treatment for that? It is just a lifestyle modification. What are the lifestyle changes we offer them is to regular intake of food, avoiding the fast food, having a regular exercises. Yoga definitely help women to regularize her cycles, and keeping the weight under control. So these are the small changes which has to be made throughout her life to keep the PCOS under control. Now why are we emphasizing so much on treatment of PCOS is because after the menopause also these changes in the body of the woman, we call it as a metabolic symptoms, can have effect on their health in the form of they are prone to develop diabetes, they are prone to develop hypertension, heart diseases, and also they are more prone to develop endometrial cancer, that is the uterine cancer. So not to get worried, there is no definite solution, but the simple solution is keep your lifestyle modified. Okay, lifestyle modification itself is a treatment for the PCOS. So know the facts, don't fear. Any help, always we are here in Rashtrotana Memorial Hospital as a team of doctors. Thank you.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.